The opioid epidemic is a health crisis. In Massachusetts alone, there were more than 1,000 confirmed opioid-related overdose deaths in 2014. That is a 63% increase from just 2012. And fighting this epidemic will take smart, creative ideas like the efforts of Chief Campanello of the Gloucester Police Department. They have an Angel initiative that ensures that anyone who enters the police station and asks for help with drug addiction receives it without getting arrested. Dr. Nguyen, how does this type of initiative save both our justice system and our healthcare system money and at the same time save lives?
Thank you, Senator Warren. Chief Campanello actually just came to visit us in Baltimore yesterday, and so we had a chance to learn about his approach. We know that addiction is a disease. We know that we're not going to be arresting our way out of it, that we also have to provide treatment. And so providing this no wrong door, decreasing barriers into treatment is critical. And so I very much applaud the initiatives in Massachusetts. I wish to add, though, that there are two other components, which is that there must be enough treatment options so that when somebody comes to the police department or the ER or somewhere else for help, that they must also be connected into treatment at that time immediately, not wait 3 weeks or 4 months or something, but be connected immediately. And also that there are continued community support services that are also reimbursed, that we must be reimbursing our community health workers at the rate that they deserve, and also that we must have reentry services and housing and other support that's critical for individuals with addiction.
Good. Excellent points, but we've got a good entry point here with the Angel program. You know, this Gloucester program is a great example of local leaders understanding what it takes to treat substance use disorders on the ground. It takes hard, compassionate work by law enforcement, by medical professionals, and by members of the community. The federal government also needs to help here. For example, the National Institute on Drug Abuse estimates that over 70% of adults who misuse prescription opioids get the medication from friends or relatives, meaning many patients receiving these prescriptions aren't using all of the medications that were prescribed for them. States like Massachusetts are considering policies that would allow opioid prescriptions to be dispensed by pharmacies a few days at a time. It's called a partial fill, so that patients don't receive more drugs than they will actually use. Professor Valek, how could the use of partial fill policies help to prevent opioid misuse and abuse?
Thank you very much, Senator Warren. We believe that all policies related to prescribing and dispensing of opioids should balance the desire and the need now to reduce abuse, misuse, and diversion, while at the same time not putting up barriers for people who have legitimate medical need for those drugs. So I think it becomes, in our view, an issue for the physician and the pharmacist to determine what is appropriate at the time for that patient to receive, and that it may not be something that for any given patient we can say what that optimal quantity
Well,
would
and
be.
what we're looking for here, obviously, is to have fewer loose drugs around. But current DEA regulations are silent on whether partial fills are allowed outside long-term care facilities or an acute pharmacy shortage. So states that want to implement these policies don't know for sure if they're legal. I'll be sending a letter to the DEA with Senator Markey to request that the agency clarify these regulations. It is important to reduce the amount of unused medication out there, and that means people also need to know how to dispose safely of their excess opioids. But here's a problem. The FDA, the EPA, and the DEA all have different recommendations on how to do this. And while all the agencies highlight that the ideal plan is to take them to a police station or pharmacy for collection, there are varying recommendations about whether or not to throw them in the trash, the best way to do so, whether to flush them down the toilet, and so on. Dr. Nguyen, can you clarify how people should dispose of their unused drugs?
Thank you, Senator Warren. The answer is do not flush it down the toilet, don't throw it in the trash can, but take it ideally to a permanent drop box. We just implemented in Baltimore City a couple of weeks ago, actually, 9 permanent drop-off areas, all at our police stations across the city. They are 24/7, no questions asked, which is critical because you do not want to be arrested while you're bringing these drugs back. And I also want to emphasize that this is not only important for prescription opioids, but also for any medications. I've seen 2-year-olds take their grandparents' high blood pressure medications or insulin and also overdose on those and die as well.